Hi, hello, welcome back to our channel. So today we are going to discuss what we have to check before handling the complete denture to the patient, and even the patient before leaving from the clinic, what all things we have to confirm with the doctor for the fit, and how the fit should be there, and what all things we have to check before leaving the clinic. So come, let's go into the topic today. So when we are receiving or handling over the complete denture to the patient, we have to examine the fit, we have to check the fit, and we have to ask for the proper instructions to maintain the complete denture at home. So in this video we are going to discuss about the fit. So what are the checklists we have to examine the fit of the denture with yours, and what are we have to ask with the doctors, and how to ask for the instructions and maintenance. And instructions and maintenance we are going to see in the next video, and in this video we are going to discuss about the fit only. So first we have to examine the denture by just running your hand over the corners of the denture to examine the sharp points or rough edges and all. So if there is any sharp points or rough edges, it is going to disturb your soft tissue, and it will cause the ulcer or irritation to your soft tissues. So we have to check for the sharp edges and rough edges, and we have to notice the tissue part, that is soft tissue areas where there is a presence of voids or nodules, and then it is followed by examination of the patient's mouth. So when we are examining the patient's mouth, we are going to avoid or rule out the extension of the denture over the mucosal area, and we are going to trim the excess part if there is any presence of the extension of the denture beyond the exact measurements, and then followed by the adaptation of the denture, where in the posterior area it is extended all over the denture, or it is there any leftover space, or in buccal side, buccal mucosa, is there any extension or the bulk is increased, whether it is disturbing the buccal mucosa. And that we have to check for the frenal relief also. So if there are any frenal attachment, or it is embedding on the frenum, there will be easy removal of the denture if they move their lips. So all these should be ruled out, and we have to ask the patient to say ha in a bursting way. So if they say ha in a bursting way, if there any extension, or if there any adaptation compromise, or if there any frenal attachment compression, all these things, if there are any one of these things, the denture won't fit in the mouth, it will just come out, and we have to ask the patient to close the mouth and open. So if there is any compression of the frenum, there will be a release of the denture immediately when they move their lips. So all these should be checked, and followed by checking the or evaluating the aesthetics. So after completing whether the midline is exactly placed, and the tooth alignment is good, and the teeth set is more aesthetically satisfying the patient, and all these should be checked. Mostly this part of aesthetics will be checked during the train itself, so there won't be so much of difference between the train and the delivery time, that is when they are when you are finishing the denture. So evaluation of the functional part, the first thing is we have to evaluate the retention of the denture. So when you are placing the denture, it should not just fall just like that. So in the for posterior retention, how we have to check is we have to just tap the anterior teeth in a perpendicular manner. So at that time the posterior denture should not come down. So if you're pushing it in front, if it comes down, it will be a problem in the future when they are chewing also. Whenever they bite, the posterior denture will get released and the denture will be removed. So in anterior, how to check is, after completing the posterior check, we have to remove the denture in opposite to the path of insertion. So we are not supposed to remove the denture in the same path of insertion. So if you are removing in the same path of insertion, it will come out. Other than that, it should not get removed. So in any other path, it should not get removed, and that will increase the retention of the denture. So in mandible, we have to check in the retromolar paths. So it is followed by jaw relation, which is mostly we are done in try-in. So we have to verify the jaw relation once more for our comfort, and then it is followed by speech. As the tongue gets the help of the soft tissue of the palate for the speech, we are going to give a smooth palate. So they usually take the help of the rugae in the palate for the speech. So in the denture, we are not going to have a rugae or the rough surface to get the proper speech. We have to check for the proper speech of the patient for giving them more comfort. And if it is a metal base, that is, the palate is going to be made of metal base, it is we can make it as thin as possible, so it will not so much replicate in the speech problem. But when we are giving a normal denture, complete denture, there is going to be a speech problem, so we have to check before delivering the denture. So normally we are going to check the S pronunciation, and at the same time we are going to check for the buccal sounds, that is B, P and yum. At the same time we are going to check for the labiodental sounds, that is F and V. And also we are going to check for lingo-alveolar sounds, that is T, D, S, Z, V and L. So after the speech evaluation, we are going to go for occlusal evaluation, where we are going to check for the high points, because there should not be any trauma after the placement of the complete denture, and while chewing and while using the denture, they should not have any trauma. So we are going to check for high points by using the articular paper. So when we are clipping the articular paper, we can check for the high points by the blue markings, and we are going to gently reduce it, and we are going to hand it over the patient. So not just after these evaluation it is done, we also have about 6 months follow up for the same, because there is a certain period where there will be a discomfort noted, where there will be a high point noted, and of course there will be a retention and stability problem noted within the 6 months, and they have to go for follow up for ruling out all these problems in the future. So all these follow-ups, and why we have to go to dentist, at what time we have to go to dentist, and what are the instructions should be followed at home for the maintenance of the denture, is all explained in my next video. Please do like, share and subscribe to this channel, and please give the bell button on, so that you will get the notification when I upload my next video.